At 52 years, Alaisa Naibira is one of the few lucky albinos still living, as many of them are reported to die before the age of 40. The last decade of her life, however, has been one filled with agony, as a cancerous wound eats a part of her face. Naibira's woes started with a simple cut after she was involved in an accident in 2002. She says she underwent 3 operations at Jinja Hospital to cover up the gaping wound. Doctors there referred her to Mulago Hospital for further evaluation. It was from the National Referral Hospital that she received the news that she had skin cancer. Frustrated, Alaisa has since returned home. Over the years, this mother of 6 has had to endure relentless pain, a rotting skin, and unbearable odor given off by the wound. She was only lucky to get good Samaritans from Hospice Uganda who are giving her palliative care. Even as Naibira is helped to cope with the physical pain, her greatest torment is the fact that her hope of living to see tomorrow is really limited. An association, the Source of the Nile Union for People Living with Albinism, has recorded 6 skin cancer-related deaths since the beginning of this year. Naibira, a resident of Bugonda Mbulamuti in Kamuli district, is one of the 6 albinos currently battling skin cancer in the Busoga sub-region.
The skin cancer affecting albinism can be preventable. In fact, they are very preventable if we take more as a precaution to protect our skin from sunshine. So now, as an organization, we are providing free wide-brimmed hat. We are giving out free sunscreen lotions. We are giving out also long-sleeved clothing.
Sunscreen creams play a vital role in protecting the delicate skins of people living with albinism. These lotions, however, are expensive and beyond the reach afforded by majority of those who desperately need them.
There are a lot of tax duties that are imposed on these sunscreen lotions. That makes them to become very expensive. And sometimes when we are given opportunities when we are donated some of these items like sunscreen lotion, it becomes very expensive for us to import them.
Peter Ogik, the chairman of the union, says the breakdown of the radiotherapy machine at the Cancer Institute has left patients like Naibira with very little hope of survival.
Members whom we sent there, some of them, they require radiotherapy. And as we don't have others that referred to other countries who can provide those services, and yet it's very expensive.
The albinos also want the government to consider providing hospitals with machines that can improve the early detection of cancers in groups vulnerable to the disease.
And another thing that we are asking government is also to include people with albinism into cancer policy. This, I think, it will help people with albinism also to get really these treatments at free cost.
The delicate nature of the skins of people living with albinism leaves them at a greater risk of suffering skin cancer. In fact, up to 98%, according to available research, of these people are said to die before the age of 40 due to skin cancer. Getrude Uwitware, NTV, Kamuli District.